After blocking Dr. Anthony Fauci from testifying about the federal coronavirus response before the House, the Trump administration now says it will allow him to go before the Republican-controlled Senate sometime next week. The official explanation as to why Fauci couldn't speak to the House had been that it would be, quote, counterproductive and take him away from his main focus. But today the president offered a different explanation.
The House is a setup. The House is a bunch of Trump haters. They put every Trump hater on the committee, the same old stuff. They frankly want our situation to be unsuccessful, which means death, And our situation is going to be very successful.
So what does the president mean by success? Well, he elaborated.
Right now, the stock market's way up. Everybody's excited. They're going back to work safely, but they're going back to work. We're opening up our country again. And this is what we're doing. And I'll tell you, the whole world is excited watching us because we're leading the world.
Now, as for the concerns about reports of dramatically rising death tolls, the president brushed them off.
That's a report with no mitigation. So based on no mitigation, but we're doing a lot of mitigation. And frankly, when the people report.
The president appeared to be referring there to yesterday's New York Times report on a draft projection that estimated 3,000 deaths a day by June 1st, more than double prior estimates. Johns Hopkins University, which did at least part of the analysis that was leaked, has since said it was based on preliminary data and showed just one scenario if restrictions were loosened too quickly. So calling it a forecast is not accurate, according to them. But it's still unclear exactly what kind of loosening of restrictions would lead to that number. And a separate model frequently used by the White House itself out of the University of Washington is now predicting more than 134,000 deaths by August, more than double its projection before states started reopening. Still, the president has his doubts and a seemingly singular focus.
Look, models have been very inaccurate. I've seen models that are very inaccurate. But you know, one model that's very important is that if we did this a different way, we would have lost more, much more than 2 million people. And we did it the right way. We did everything right, but now it's time to go back to work. There's no win, just so you know, there's no great win one way or the other, but I'll tell you where there is a win. We're going to build a country. I did it once. 2 months ago, we had the greatest economy in the history of the world, the best employment numbers we've ever had in history, right? I mean, everybody agrees. Even CNN agrees with that one. But I will say this, we're going to do it again, and that's what we're starting. And I view these last couple of days as the beginning. We're going to build the greatest economy in the world again, and it's going to happen pretty fast.
So we know where the president's concerns lie, but what about those of public health officials? I'm joined now by Dr. Ashish Jha. He's director of the Harvard Global Health Institute. Good to see you again, doctor. Thanks for being here.
Thanks for having me back.
So you just heard the president dismisses these higher death and infection forecasts. Do you dismiss them as well?
I don't. I am very worried about what is going to happen in the upcoming weeks and months, mostly because of basic biology. As we loosen up restrictions, more people are going to start interacting with each other. Infection numbers will go up. And more people will get sick, and unfortunately, some of them will die. So I'm very worried about that.
You know, one of the things I didn't understand when Johns Hopkins seemed to be walking back what had been leaked is I read part of their statement today, and they said the information illustrates there's some scenarios, including the premature relaxation of social distancing, that were likely to cause significant increases in the number of COVID-19 cases and deaths in the U.S. That's exactly what their original assessment was saying, was it not?
Yeah, I think everybody agrees that the number of cases is likely to go up. And again, there are things we can do to keep that down, by the way. So the question is, will we? But everybody agrees that without a big ramp up on testing and tracing and isolation, if we relax restrictions, number of cases are going to go up, number of deaths are going to go up. So I don't know the specific context in which Hopkins felt the need to pull back on that description. But no one I know thinks that the cases are going to miraculously just disappear on their own.
Well, actually, there's one person, I don't know if you know him, but there's one person who feels we don't need to take those measures. Here's the president. I believe this is from his virtual town hall on Fox News on Sunday at the Lincoln Memorial, assessing the current state of affairs.
There's not too many states that I know of that are going up. Almost everybody is headed in the right direction.
Is almost everybody headed in the right direction, Doctor?
So about 10 states are headed in the right direction. So it depends on your definition of almost everybody. But I would say that leaves about 40 states that are either flat or going up. And, what's interesting is the president's own task force created a plan of what states need to do before they can begin opening, including 14 days of downtrending number of cases. Very, very few states have met that criteria, and states are defying the president's own recommendations on what should be done before states open.
And one of the additional guidelines, I'm surprised you left it out because it's your mantra, is a robust, to use their adjective, a robust testing program as well. Another one of the criteria, correct? When you hear the president, there was a wonderful story and a shocking story in the Washington Post today about how the states and their governors that are praised most by the president are those governors who are defying the guidelines that he himself, the president, put out. And governors who are adhering to the guidelines, for example, like the governor of Virginia, who is seeing his cases go up and as a result is not yet loosening the restrictions, is trashed by the president. When you see him praise those who are flying in the face of his own rules, what does that do to you, doctor? What does it do to your blood pressure, doctor?
I think it reminds me that I need to pay less attention to what the president is saying and focus more on helping states get through this. Look, there's been such erratic federal leadership. The action really has now moved to states. By the way, having 50 states all figure out their own plan for a pandemic is not how we want to be fighting this as a country, but that's where we are as a country. And I don't think it's helpful when the president is critical of governors who are trying to save lives and really protect their own people.
It seems, well, it's not helpful in a number of ways. It seems to me one of the ways it's least helpful is for the average person who is living in fear for the most part and a state of confusion. To say you're getting a mixed message on steroids is an understatement, is it not?
Yeah, and what's been remarkable about this is that the American people mostly have gotten the message right.
I agree.
If you look at the polling, people are genuinely nervous about going out to restaurants, going out to bars, going out into public spaces, unless there's more testing and tracing and all of that stuff. Americans have gotten the message because I think, folks like you have been getting the message out. But it is not helpful, just to go back to that phrase, it is not helpful for the president to be saying things that he must know are not true and his own task force says are not true.
I would say it's folks like you getting the message out, but we can have that debate a little bit later. Speaking about your major theme, testing, and more testing, when you were here a couple of weeks ago, you said, as you've said virtually everywhere across America, we need to at least triple our testing, if not more, to reach a threshold that would make it safer for there to be reopening. Once again, the president appears to disagree with you. Here he is earlier today on the issue of testing.
Look, we have so much testing. I don't think you need that kind of testing and that much testing, but some people disagree with me and some people agree with me. But we have the greatest testing in the world and we have the most testing in the world.
Are we anywhere close where people like you believe we need to be, Doctor?
Yeah, so outside of the president, I don't actually know anybody who thinks we have enough testing. And I've spoken to folks at the White House on the task force, and they all agree we need a lot more testing. So I'm a little confused by what the president is saying. And the bottom line is the reason we need testing is because we need to know if you're going out, I think I've said this before, if you're going out for a cup of coffee, you're going to Dunkin' Donuts, you want to make sure the guy giving you the cup of coffee is not infected, shedding virus. The only way we're ever going to know those things is if people are getting tested on a regular basis. That is not anywhere close to where we are in the country right now.
Well, talk about a disconnect. You'll have the vice president echoing what the president says, saying we're sending out X million number of tests. And 2 minutes later, you hear the governor of Colorado saying he just purchased 500,000 tests from, of all places, South Korea. So assuming that the president will not be a partner in ramping up testing, as you said before, it's 50 states and D.C. on their own. How do they do that? How do they get from where they are to where they need to be?
Yeah, so what we're seeing is a consortium now. You see states coming together. So the states in the Northeast coming together, banding together, a group in the Midwest, a group in the West. Essentially, instead of a single United States of America, we're going to have multiple groups of states of America. That's better than everybody doing it individually. But boy, if only we had a federal government that was willing to engage and help, it would make a big difference.
You know, one of the things that's been most troubling to me, it's hard to say anything is the most troubling, but one of the things that's been troubling to me is the virtual disappearance of experts from the White House presentations over the last week or so. The head of the CDC, I think you could find on a milk carton more easily at a White House coronavirus task force. And then we hear today that Vice President Pence is suggesting that the whole White House coronavirus task force might be winding down. What's your reaction to both or all of those developments, Doctor?
So I've written quite a bit about the loss of expertise in this outbreak. The CDC, which is our national public health agency that I, as a public health person, grew up loving and admiring, they've decided to essentially take this pandemic off. Now, I know the scientists are still there, the epidemiologists are still there, the experts are still there. But for whatever reason, the agency is not allowed to play an effective and helpful role in this pandemic. And it's emblematic of a broader problem, which is there's been this belief in the White House, I think, that if you ignore this problem, if you close your eyes and act like the pandemic isn't here, that it will magically go away. Maybe by April, maybe the cases will go to zero. The problem is biology doesn't really much care whether you're going to ignore it or not. And the biology of this virus, which while we're still learning it, is pretty clear in as much as it's going to continue growing, continuing infecting people, continuing hurting people, unless we tackle it head on. And that just isn't happening from the federal government, from Washington. And so we're going to have to do it from state houses across the country.
Last thing, one of my dreams, and maybe fantasies, is all of these experts who are credible quit en masse the task force or any other federal responsibility and start holding their own press conferences, 4 o'clock every afternoon, to tell the American people the truth. Is that a ridiculous fantasy or something we should pray for?
So I don't think that the folks like Debbie Birx and Tony Fauci are going to quit. And I have to tell you, I'm glad. Because we still need the federal government, even if it's not being as effective as it needs to be. Thank God Dr. Birx, Dr. Fauci are there, because I think they are doing God's work. And I'd much rather have them inside. And those of us who are on the outside, we can maybe start holding our own outside accountable sort of press conferences to inform the American people. But the experts who are there, they're not as impactful as I wish they were, but they're still having some impact. And I'm just grateful to them that they're sticking it out.
Well, if you're grateful, I'm grateful. Dr. Jha, good to see you yet again. Thanks so much for your time.
Thank you, Jim.